Hello everyone, if you have come to watch this video, it means that you have the thirst to study anatomy well and you want to gain enough knowledge so that you can enhance your preparation well and do well in the exam. Welcome you all, this is Dr.Auroraj and we are going to study the lower limb of anatomy. We will be discussing about the lower limb, we'll discuss about the thigh, legs, we'll discuss about the lumbar plexus. We'll be also looking at the sciatic nerve, femoral nerve, and the TBL nerve. Along with that, we'll also study about the common peroneal nerve and the sural nerve. Yes. Popliteal fossa is going to be very important for the exam. This has been all the important high yield topics. The glutes, which has been also commonly asked. We'll study about the gluteus maximus, minimus, and also the medius. We'll discuss about the pelvis, leg, knee, and also the tarsal bones. So this video will help you to have a very good knowledge about your lower limb. Let's go. The incidents which has happened in RJK Medical College is something intolerable and unimaginable. In the country where it is very difficult to become a doctor, she has completed the course, internship, NEET PG preparation, and 2 years of residency. Down the line, she could have become a specialist. She was one among us where she has undergone all through this journey. It is a pity that we have missed her. We should make sure that such an incident should never happen in our mother India. And we demand a justice soon for her. And we should make sure that this is never going to repeat in our country. Let's hope and make sure that she's going to get the justice soon as possible. Lumbar plexus. Let's study the important nerves here. You are going to focus on this orange colored nerve, which is called as what? The genitofemoral nerve. Genitofemoral nerve having root value L1 and L2. L1, L2. Genitofemoral nerve. Very good. It's a question. Next, the red colored nerve here, this is going to be the obturator nerve. Obturator nerve having root values L2, L3, L4. L2, L3, L4, obturator nerve. Next, this blue colored nerve over here, this is going to be the iliohypogastric nerve. Iliohypogastric nerve. And this is going to be the ilioinguinal nerve. Both having root value L1. Yes. Next, this green color one, this is going to be the lateral femoral cutaneous nerve. Lateral femoral cutaneous nerve. And this one, the pinkish one here, this is going to be the femoral nerve having root value L2, L3, L4. Now to make it more simplified, obturator, femoral and the lateral femoral cutaneous nerve have the root value L2, L3 and L4. Yes. Sciatic nerve is not only important for the exam but also during your practice. You might definitely come across patients who are suffering from sciatica. Yes. Now we will study about sciatica as well as the anatomy of the sciatic nerve. Now this nerve here marked in green color, this is going to be the sciatic nerve. It exists via the greater sciatic foramen. Greater sciatic foramen. It has the root value of L4, S1, S2 and S3. Yes. As it descends down at the popliteal fossa, it bifurcates into the tibial nerve and common peroneal nerve. This nerve is going to be the tibial nerve and this is going to be the common peroneal nerve. Now remember, CPN, common peroneal nerve, is also called as common fibular nerve. Great. Now let's revise the content. Sciatic nerves, spinal nerves are going to be L4 to S3. It exits via the greater sciatic foramen. It's a question to remember. Bifurcates at the popliteal fossa into tibial nerve and also common fibular nerve. Now, remember, patients suffering from sciatica, they will have severe pain in the leg regions, in all these regions. Yes. It is due to the injury to sciatic nerve, or it could be also because of the herniated disc in this region. Yes. So this is about sciatica and sciatic nerves. Femoral nerve. This green colored marked nerve is going to be this femoral nerve having root value L2 to L4, L2, L3 and L4. It supplies the anterior compartment of the thigh. Anterior compartment of the thigh supplies the quadriceps femoris, supplies the sartorius muscle, quadriceps femoris, and also the pectineus muscle. Yes, let's repeat again. Femoral nerve supplies sartorius, quadriceps femoris, and also pectineus muscle. Very important. Now, the cutaneous branch of the femoral nerve, it is going to be medial cutaneous nerve of the thigh, intermediate cutaneous nerve of the thigh, and also saphenous nerve. These are very important. Please remember saphenous nerve, which is going to supply the skin of the medial part of the leg and foot. Remember, saphenous nerve supplies the skin of the medial part of the leg and also foot. Yes. Obturator nerve. Look at this here. This is going to be the obturator nerve. Yes. From the anterior division of L2, L3 and L4, it supplies the medial compartment of the thigh. Medial compartment of thigh. Very good. Muscle supplies are very important. Most of the muscles supplied by the obturator nerve starts with letter A, luckily, and they are abductors. Abductor longus, abductor, look at this. This is going to be the abductor longus muscle right over here. Abductor brevis and abductor magnus. Very good. Along with that, it also supplies the gracilis muscle, which is also called as anti-rape muscle. It's a question, and remember it, please. And also pectineus muscle, medial half of the pectineus muscle. These are the obturator nerve muscle supplies. Good. TBL nerve, we have just studied that the sciatic nerve bifurcates at the popliteal fossa into TBL nerve and common peroneal nerve. Now, TBL nerve spinal root is going to be L4 to S3. L4 to S3. Very good. Now, what are the muscle innervations? Very important. Let's focus. This is going to be gastrocnemius. This is going to be the medial gastrocnemius and lateral gastrocnemius. Okay. And then here, the popliteal muscle, which is also called as the peripheral heart. Very important. Peripheral heart. And also it supplies the plantaris muscle, and it is going to have long tendon. The longest tendon present in the body is going to be of plantaris. Also very important to remember. And then it also supplies the soleus muscle and tibialis posterior. Tibialis posterior muscle, along with flexor digitorum longus and also flexor hallucis longus. These are the important muscle supply of the TBL nerve. Let's revise once again. Gastrocnemius, popliteus, plantaris, soleus and tibialis posterior. Great. This nerve here, this is going to be our TBL nerve. Common fibular nerve. This is going to be our common fibular nerve. It is going to supply the posterior lateral part of the leg. Posterior lateral part of the leg. Again, root value is going to be L4 to S2. L4 to S2. Yes. Now, this common fibular nerve is divided into deep and superficial. Deep and superficial. Yes. The deep part is going to supply the anterior compartment. Please remember. And the superficial part is going to supply the lateral compartment of the leg. Yes. I hope you have understood this. Now, what are the muscle being supplied by deep common fibular nerve? It is going to be peroneus tertius, tibialis anterior, extensor hallucis longus and also extensor digitorum longus. Now, the superficial part of common fibular nerve is going to supply the peroneus longus and also peroneus brevis. Please remember the muscles. Let's give it a quick revision. We studied about sciatic nerve. Yes. We studied also that it divides, it bifurcates at the popliteal fossa into tibial nerve and common peroneal nerve. Easy. The tibial nerve, it supplies the posterior compartment of the leg. The common peroneal nerve further divides into superficial peroneal nerve and deep peroneal nerve. The superficial, it supplies the lateral compartment of the leg, and the deep peroneal supplies the anterior compartment of the leg. I hope this helps you to have a good revision. Next, let's move on to sural nerve. It's a very important nerve for the exam as well. Now, the tibial nerve, It gives rise to the medial sural nerve, and the common fibular nerve gives rise to the lateral sural nerve. It combines to form this nerve called as sural nerve. The sural nerve actually supplies the posterolateral aspect of the leg as well as the foot. It supplies the posterior part and also the lateral part. This is going to be the sural nerve. Very good. Now, the area right over here where our chapels are being held, it is going to be supplied by deep fibular nerve. Deep fibular nerve. So this concludes most of the points to remember about sural nerve. Let's study some important muscles. Leg. Let's revise. The anterior compartment is supplied by deep peroneal nerve. Yes, it supplies the tibialis anterior. This is going to be tibialis anterior. Very good. It also supplies the extensor hallucis longus. Extensor hallucis longus and also extensor digitorum longus. Yes, let's see the muscle is being supplied. Also the digits of the foot. Good. The lateral compartment, as we have studied, is going to be supplied by superficial peroneal nerve, which is going to include the peroneus longus and also peroneus brevis. Peroneus brevis. Good. Posterior compartment, we all know very well that it is going to be supplied by TBL nerve, and the medial compartment, which is being supplied by obturator nerve. These are the important nerves which are supplying your leg. Focus on the image here. This area right over here, this is called as femoral triangle. Yes, if you dissect this area, you will come across the following structure. This is going to be the femoral nerve. This one is going to be the femoral artery and then femoral vein and also lymph nodes. These are going to be the contents of the femoral triangle. Yes, femoral artery, femoral vein, femoral nerve and lymph nodes. Yes. It is also very important to remember the boundaries of the femoral triangle. Remember, laterally, this muscle over here, this is going to be the sartorius muscle. Laterally, it is being supplied by sartorius muscle, and then base is going to be supplied by the inguinal ligament, and medial border is going to be the abductor longus. Medial border, abductor longus. Right over here. Yes. Look at the beautiful image here. This muscle here, this is going to be the semitendinous muscle. Yes. And this one is going to be the semimembranous. Here we have the medial gastrocnemius muscle, and this is going to be the lateral gastrocnemius. This orange color word highlighted is going to be the plantaris, and this is going to be the biceps femoris. Yes. Now it is very important to know the contents of popliteal fossa. What are they? They are going to be the popliteal artery, popliteal vein, and then also the tibial nerve and common peroneal nerve. These are going to be the contents of popliteal fossa. Number one, popliteal artery, popliteal vein, we have tibial nerve and also common peroneal nerve. Great. Now let's revise the muscles once again. This muscle right over here, this is going to be the semitendinous. This is going to be the semimembranous. Here we have the biceps femoris, and then this muscle right over here is going to be the plantaris. These both muscles are going to be gastrocnemius, lateral and then medial. That's it. I hope you will remember popliteal fossa and its content. Glutes. We all know that gluteus maximus is the largest muscle. Yes. This muscle right over here, this is going to be the gluteus maximus, which is the largest muscle. It is supplied by inferior gluteal nerve. Inferior gluteal nerve. It helps when you climb upstairs and also standing up from sitting position. Very important. It helps for extension of the hip joint. Good. And the muscle right over here, this is going to be gluteus medius. It is supplied by superior gluteal nerve. Superior gluteal nerve. Now, if you dissect these two muscles, you will see the following muscles. This is going to be gluteus minimus. This is going to be gluteus minimus. It is also supplied by superior gluteal nerve. Superior gluteal nerve, which is going to help for abduction of the hip joint and also stabilize the pelvis. Which is going to stabilize the pelvis? Gluteus minimus. This one, very important. If you can put some extra efforts, you can also study these muscles, which is going to be this one right over here is going to be the superior gemellus, and this is going to be the inferior gemellus, and this muscle right over here is going to be the quadratus femoris, and this is going to be the piriformis. Great. You might have come across people who are walking like ducks. It is called as waddling gait. It is called as waddling gait. It is due to injury to the superior gluteal nerve on both sides. Injury to the superior gluteal nerve on both sides. Now, this is called as lurching gait. When the patient leans towards one side, it is called as lurching gait. And when the gluteus medius muscle, when it weakens, the patient walks like this, and this is going to be Trendelenburg sign positive. It is called as Trendelenburg sign positive. Good. Let's study the hip joint. We all know it is ball and socket joint. It's easy one to remember. For our exam, you are going to also remember that iliofemoral ligament. It is the strongest ligament of the body. It's very important. It is also called as ligament of Bigelow. Now, let's see where they are. This muscle right over here, this is going to be the iliofemoral ligament. Now, as an extra edge, you can also remember the fibofemoral ligament. You can also remember the inguinal ligament right over here. This is going to be the inguinal ligament. So, please also remember these ligaments, which are very important for the exam. Knee joint, it's probably one of the familiar joints for you all. This bone here, this is going to be the femur, this one is going to be the patella, and this is going to be the tibia, and here is the fibula. Now, we all know that knee joint is a synovial joint. Now, also remember femur and tibia, they are combined by bicondylar joint. Whereas femur and patella, they are of saddle joint. Please remember these 2 points. The ligament right over here, which you see here, this is called as anterior cruciate ligament. It actually prevents posterior slipping of the femur on tibia. It's very important. It prevents posterior slipping. Now, the tear can occur when it is undergoing hyperextension. Hyperextension can lead to anterior cruciate ligament tear. You can see it here. This is the anterior cruciate ligament tear. Good. And this ligament right over here, this is called as medial cruciate ligament. And as there has been a tear, it is called as medial cruciate ligament tear. Now, posterior cruciate ligament, it prevents anterior slipping. Posterior cruciate ligament prevents anterior slipping. Anterior cruciate ligament prevents posterior slipping. It's very important. And this is going to be the posterior cruciate ligament tear. Yes, I hope you can see the PCL, which is very important also. Few clinical aspects. This image right over here, this is going to be called as clergyman's knee. It is called as clergyman's knee. It is due to infrapatellar bursitis. Now, this knee, this is called as housemaid knee. This is going to be due to prepatellar bursitis. This is going to be the prepatellar bursa, and then the inflammation occurs. It is called as prepatellar bursitis, which is commonly seen in housemaid. It is known as housemaid knee. Yes. And now, talking about terrible triad. It's very important triad for the exam, which is also called as unhappy triad. Yes. When a lateral force hits your knee, there could be a tear of tibial collateral ligament, medial meniscus, and also anterior cruciate ligament. These ligaments, when they get tear, this is called as what? Terrible triad. And it comes with mnemonic called as MAT. Probably it's very easy to remember now. M is for what? Medial meniscus. A is for anterior cruciate ligament, and T is for tibial collateral ligament. I hope you will remember the terrible triad, which is going to be very, very important for the exam. Tarsal bones you would have studied right from your school days. Let's study for our exam once again. Now, it's very easy to remember as well. Let's focus. These 2 bones starts with letter C. One is going to be calcaneus. This is going to be cuboid. The one above this is going to be talus, and this is going to be navicular, boat shaped. And in between is going to be the medial cuneiform, intermediate cuneiform, and the lateral cuneiform. That's it. Now, let's revise once again. This is going to be calcaneus, this is going to be talus, this is going to be cuboid, this is going to be navicular, and the cuneiforms. Great. Now, remember, talus has no muscle attachments. No muscle attachments to Talis. It's a question to remember. Ankle joint. Remember, ankle joint is going to be synovial joint. Another question. It is a subtype of hinge joint. That's it. Very good, doctors. Now, let's study eversion and inversion. Eversion, here, it is due to elevation of the lateral border of foot. Lateral border of foot. It could lead to tear where? To these muscles is going to be peroneus longus, peroneus brevis. Remember, peroneus longus and peroneus brevis. It is a what? Subtalar joint. Now, inversion is going to be medial border of the foot. It includes tibialis anterior and posterior. Tibialis anterior and posterior. It is also of subtalar joint. Subtalar joint. So you can see the inversion here, which includes the tibialis anterior and also posterior muscles. Thank you. Doctors, you alone can change your life and you have the power to do it. It will keep you motivating to get closer to your dreams and achieve it. Keep studying well and you are going to rock in this December. All the best. Happy learning. Keep studying and keep smiling. Thank you guys.